crossing the threshold from classroom to bedside. Nursing students move beyond technical tasks to navigate the profound emotional landscape of human experience and genuine compassion. Good day, everyone. We are the Group 4B, and today we're going to present our study titled Care to Compassion, the lived experience of nursing students during their initial clinical exposure. The purpose of this study aims to explore their lived experiences during their initial clinical exposure, focusing on emotions, challenges, and the development of their professional identity to help enhance clinical education and student support systems.
To capture the essence of the student's journey, the study employed semi-structured interviews as the primary instrument. By utilizing open-ended prompts, the researchers invited participants to reflect deeply on their initial clinical exposure, transforming personal anecdotes into meaningful data. It also consisted of three parts, which were part one is the participant's profile, where the researchers gathered the participant's social demographic profile. Part two is the overarching question, which included the main question about the participant's initial clinical exposure experience. And part three are the probing questions, which serve as a follow-up questions to have a better understanding of the overarching question.
This study used a phenomenological qualitative research designed to explore the experiences of second-year nursing students during their initial clinical exposure. Data were collected through in-depth interviews, which allowed participants to talk about their personal experiences, emotions, and challenges during their initial clinical exposure. The data gathering procedure started with gaining technical and ethical approval. This study strictly adhered to the ethical principles of autonomy, respect, privacy, confidentiality, beneficence, non-maleficence, and justice to ensure the protection of participants' rights and welfare. Pseudonyms were religiously implemented to ensure participant confidentiality.
The participants were 8 to 10 second-year nursing students enrolled in a private nursing school located in Bacolod City, Negros Occidental. Next is those who are undergoing or had already undergone 2 to 4 clinical exposures in the OB ward and PG ward. Next, within the age bracket of 19 to 21 years of age, and lastly, those willing to share their experiences openly. For the demographic profile of the participants, this study involved 8 second-year nursing students from a private institution in Bacolod City, Negros Occidental, with 2 to 4 initial clinical exposure. The participants were in the age bracket of 19 to 21 years old. Out of 8 participant statements, 4 major themes evolved, which each with 2 sub-themes.
Theme 1, Navigating the Emotional Whirlwind. Sub-theme 1A, Managing Anxiety and Overthinking Duties. I felt nervous because this would be my very first exposure. Basi wala kami kabalo kung ano obrahon. Kung madala ko sa akon kulba, malimtan ko tanan ko ng tunan. Pero nadala lang ko sa akon overthinking. Sub-theme 1B, Recognizing the Influence of Initial Clinical Exposure. I felt a mixture of excitement and anxiety. I was excited because I could apply everything we learned into real-life situations. Seeing actual patients made everything more real and meaningful. I realized the seriousness of the profession and that patient safety depended on our actions. For Theme 2, Moving from Simulations to Real-Life Care. Sub-theme 2A, Transitioning from Mannequins to Real Patients. As a first year, daw puro lang GRD. Ang patients are just your classmates, and in our clinical exposure, it's real patients. They're real people na may mga sakit kag may mga ginabatsyag. Kag ang ginatunan mo, gina-apply mo na gid in real setting. Sub-theme 2B, Shifting from Classroom Theory to Hands-on Care. Some theories and concepts are being applied. Clinical skills from GRDs are applied, but at the same time, there are things that the school doesn't teach us, and the hospital shows the reality beyond what is taught in nursing education.
Theme 3, Committing to Compassion and the Nursing Calling. Sub-theme 3A, The Power of Communication and Presence. Nursing care isn't just the technical part. It must be done with compassion. Showing compassion in a person's vulnerable state means a lot. A simple kamusta ka ma'am or ari lang ko di can heal something within them. Sub-theme 3B, Empathy through Patient Vulnerability. When I interacted with patients and saw them in vulnerable conditions, some in pain, some anxious, some needing someone to listen, I realized nursing is not just about procedures, but about empathy, kindness, and understanding. Even simple conversations and small acts made a difference. Behind every diagnosis is a person who needs genuine care. Theme 4, Finding Strength in the Clinical Ensemble. Subtheme 4A, the RLE Group Support System. At first, it was nervous and overwhelming, but with my RLE group and CI, wala kami gina-pressure, it made the experience bearable and fun. Ang excitement kag inspiration ng upod ka akong groupmates ang muna naka-help cope sa negative feelings. Subtheme 4B, Assurance and Support of Clinical Instructors. May times nga wala ko ni natun-an, kapangayo ko guidance from my classmates, from my CIs. Kinanglan may confidence sa self, kintun-an ko ni, kundi ka-read na lang ko.
For the conclusion of this study, clinical exposure bridges the gap between theory and practice, allowing students to apply knowledge in real-life situations and recognize the realities of patient care. Early clinical experiences foster empathy, compassion, and professional values, reinforcing nursing as a caring profession and guiding students toward a lifelong commitment to patient-centered care. This study explored the lived experiences of 8 Level 2 nursing students during their initial clinical exposure using a qualitative phenomenological approach. Findings revealed that students experience anxiety, excitement, and adjustment as they transition from classroom learning to real patient care, while support from clinical instructors and peers help them build confidence, competence, empathy, and resilience. Guided by the theories of Joyce Trevelby and Jean Watson, the study emphasized that initial clinical exposure plays a vital role in shaping students' professional identity and compassionate nursing practice. The findings highlight the importance of supportive clinical environments, effective teaching strategies, and emotional preparedness in helping nursing students successfully adapt to clinical practice. And for our recommendation, we would like to recommend for school administrators to leverage these findings to refine clinical policies and increase budget allocations for high fidelity simulations that prioritize students' psychological readiness for real world practice. And for the College of Nursing Leadership, implement structured preclinical orientations and peer mentorship initiatives to mitigate student anxiety and foster supportive group dynamics during initial rotations. And for the nursing faculty, we would like to recommend to adopt process-oriented feedback and a supportive coaching style to act as an emotional anchors for students transitioning from theory to bedside care. And for nursing students, utilize these insights to normalize their anxieties and build resilience by recognizing that emotional challenges are a natural, shared component of the nursing calling. And lastly, for future researchers, you would like to recommend them to employ longitudinal or mixed method designs to investigate how specific clinical environments and interventions.
Thank you for listening, and that concludes our thesis poster.